First here, we know that medical care can be costly, but a local man got an unexpected charge, so he came to us for some help.
He was billed thousands of dollars for an ambulance ride that only went across town. So I talked to him, the ambulance company, and the Better Business Bureau to get answers.
The physician required you to be taken via ambulance. You were given no choice.
Last October, Corbin Asbury needed emergency surgery for a hole in his intestine.
It had to be operated on that day. Otherwise, it could go into what they called septic shock.
Corbin says a surgeon wasn't available at Aurora Bay Care in Green Bay, so he says doctors told him he needed to be taken by ambulance to HSHS St. Vincent, less than 6 miles away.
I tried to ask, if my mom, who was also there, could transport me, and they said no. And they said because they had given me some, pain medications, and I was going to go to another facility that I had to be transported by an ambulance.
When Corbin was taken from Aurora Bay Care to St. Vincent Hospital, he needed Advanced Life Support Service, or ALS, emergency transport. Superior Ambulance charged him $2,500 for that service. After insurance, Corbin was left with a $2,100 bill.
It's a little bit ridiculous because, it's more or less an Uber ride.
We contacted County Rescue and Gold Cross Ambulance Service. For that same level of care, they would have charged Corbin less than half that.
Each service can provide and come up with their own prices. We're a non-for-profit, so we do try to stay very competitive.
I can't comment on their rates in comparison to Superior because I have no idea.
Superior Ambulance is a for-profit business and has a contract with Aurora Bay Care. We spoke with Mary Franco, Vice President of Superior Air Ground Ambulance Service.
Why would it be so expensive? He didn't require any care while inside the ambulance. It was just a ride from point A to point B.
So I think that the fact that it's being described as a ride is really inaccurate. Because if it was just a ride, then he should have gone in a car. There was medical reason that he needed to be observed to transfer to a higher level of care. I think there's such a misconception of what private ambulance companies do. And, the cost involved with just having one ambulance on the street 24 hours a day, and the licensing and accreditation and the training of our men and women.
The Better Business Bureau says over the last 3 years, 61 complaints have been filed against Superior Ambulance across the 5 Midwestern states where they operate. 5 complaints in Wisconsin. In February, the BBB investigated Superior Ambulance's business practices due to a large volume of complaints of high or excessive fees for transport. As of April 6th, Superior Ambulance has not responded to the BBB's request for information. Aurora Bay Care declined an interview or comment on Corbin Asbury's case, but sent us this statement, quote, "Any patient who needs to be transferred by ambulance has to consent to being transferred and sign a consent form before transfer," meaning a patient can decline ambulance transfer. But in a health emergency, your cost for care may not be top of mind.
When you talk about emergencies, though, you're talking about quick patient care, meaning that patient needs to go from point A to point B. They need a higher level of care. So you don't want someone to sit back and, figure out the pennies.
Corbin says he spent months trying to get answers about his bill from Superior Ambulance, but has yet to get a clear response.
What makes me the most angry is there's just no answers.
On behalf of Corbin Asbury, would you be willing to help him lower his bill in any way because of how expensive it was for what he says a very short distance that didn't require a lot of care?
I'm not going to reduce the bill for those statements because, one, I'm not going to, say it was expensive or not expensive. 2, the short distance, that's another that I'm not going to say we're going to lower the bill because of that. Any patient that has a hardship with paying a bill, Superior will work with them.
To be clear, Superior Ambulance is not lowering Corbin's bill, but rather offered to help set up a repayment plan for the current bill of $2,100. We reached out to the Better Business Bureau for an update on Superior Ambulance's investigation, and the number of complaints against that company continues to grow. Of course, we will continue to follow this story and bring you any updates.